Hello everybody, I am Dr. Vikram Pansambal, Senior Medical Officer at Civil Hospital, working for people living with HIV, and I am into the treatment of HIV, Hepatitis B and all viral diseases. Today, on the occasion of World Hepatitis Day, that is 20th of July, every year we celebrate this day. We do not celebrate it, we just make awareness, or we just aware the people about the hepatitis and its dreadful effects. Now let us see what is hepatitis. Hepatitis is the inflammation of the liver. Inflammation of the liver, that is, hepat is liver and itis is the inflammation. Hepatitis is caused by, mostly hepatitis is caused by the viruses, and there are around many viruses which cause hepatitis. Next is drugs, other is alcohol. So these are, and some are autoimmune hepatitis also. But per se we'll talk only about today about the hepatitis part, that is caused by infective etiology, that is the viruses. There are five types of viruses which can cause hepatitis, and they are namely hepatitis A, hepatitis B, hepatitis C, hepatitis D and hepatitis E. Out of which hepatitis A and hepatitis E are waterborne or contaminated food and waterborne infections. So that is, they are transferred from this the infection one. Now hepatitis B, C and D are bloodborne diseases. That is, when this infection is we get from the infected person or infected needles, syringes, blood, etc. Now, what are the symptoms of hepatitis? In waterborne hepatitis and bloodborne hepatitis, symptoms are totally different. After knowing all the parts of hepatitis, types of hepatitis, we'll go for the common symptoms which are generally seen. Generally, hepatitis B and C and D do not show any symptoms in the early stages of the disease. But hepatitis A and E show many symptoms, and very common symptoms we see. First is fever, then fatigue, then nausea, vomiting, then yellowishness of skin and yellowishness of the sclera of the eyes. These are the common symptoms. And one more is dark color urine. So urine is much dark color and stools are pale. The potty color is pale color. So these are the general symptoms which we see. And generally A and E is a self-limiting disease. No antivirals are needed, just we have to take care of the diet, and rest is essential for that patient, and the patient gets cured within a span of 3 to 4 weeks. Now if we discuss about the bloodborne hepatitis, that is B, C and D. Generally B and D are they go hand in hand with each other, because D is not seen singularly, or it is not seen singly, but it is always accompanied with hepatitis B infection. Now hepatitis B is it's a chronic infection. You have to take care of it. And how it is transferred? It is transferred from it is directly transferred from blood, then unprotected sexual contact, then infected needles. So you can get even infected blades also, you can get this infection. So that this is the case, and you have to take, if the symptoms are there, if the liver is getting damaged, you have to take treatment for a very long time, and it gets cured, but it takes time. And once a hepatitis B positive, HBsAg positive patient is there, his lifelong, most of the patients are chronically positive for that. So it's here we have to take very care. We have to take care of this hepatitis B. Now hepatitis C is also a bloodborne disease, but it is cured by newer medicines. We have got newer medicines for hepatitis C, and it is getting cured. So in short, hepatitis A, B, C, D, E, every hepatitis is curable. Just we have to know the physiology of it, pathophysiology of it, and how to get cured for that. Now we'll talk about the prevention part for the hepatitis. For the waterborne diseases, that is hepatitis A and hepatitis C, the very easy and the simple thing is that to maintain your hygiene. If you keep a hygiene, if you eat good food, properly cooked food, and drink safe water, secured water, then you will not get this infection. Secondly, you have to educate also to the other people for keeping good hygiene. because it is a transportable disease. If it can be transmitted from the fomites also. Now hepatitis B, C, D, how you can prevent: avoid unprotected sexual contact, avoid using sharing of needles. Intravenous drug users should be communicated for that. So use of sterile syringes and needles is very essential in every day-to-day practice. Now a good thing is that in hepatitis A we have a good vaccine, which is a hepatitis A vaccine. You have to take 2 doses and that's it, you are lifelong protected with it. Similarly for hepatitis B also we have a good vaccine. You have to take 3 doses, 0, 1 and 6, and you are lifelong protected for that. In case if you get a prick or if you get infected with this contaminated needles or that, we have hepatitis immunoglobulins also, which can protect the person from getting this deadwood infection. So this was about the prevention part. Now about the treatment part. Hepatitis A and E does not require any treatment, just symptomatic treatment is more than sufficient for them. Hepatitis B, if the viral load is higher on the higher side and liver is getting damaged, you need to prescribe antiviral drugs for a longer period of time, and then you have to monitor the viral load of the patient. Similarly, in the cases of hepatitis C, many antiviral drugs are there which can be given for a short period of time, monitor the disease, monitor the viral load, and then it can be stopped. So drugs are available for every hepatitis and you should be aware of it. And how to do it? You just have to check your status about hepatitis B every 1 yearly, 2 yearly, if you are working in healthcare field or you are exposed to such atmosphere where you can get infection for that. And for hepatitis A and E, it's very simple. You have to maintain your hygiene. That's it. Now we'll talk about a small note about drug-induced hepatitis and alcohol-induced hepatitis. This hepatitis is very common in people where alcohol consumption is very large amount. So you have to prevent them. You have to educate. You have to counsel the people from taking from consuming alcohol. And drug-induced hepatitis, it's very rare, but you should know about it. And you should prevent this drug-induced hepatitis, because drug-induced hepatitis is generally from when you are treating other chronic disease like epilepsy, like HIV or any other cancer-like diseases where some drugs are hepatotoxic and that can cause hepatitis also. So you have to maintain a balance between them. So this was in a short about hepatitis.